Dr. Gerada, I mean, do you want to just tell us how you are at this moment in time?
Yes, but first I just say what a powerful emotional piece you've just shown. And I think it's a testament not just to those individuals who've survived it, but also to the health service that have given them the care in order for them to be able to tell their story. So my story is nothing like that. I was one of the first to get COVID in this country. I got it in early March, having come back from New York. And it was a pretty awful disease. There's no saying that it wasn't. And my main symptom was severe muscle pain to the point that I would have rather cut off my legs than experienced it. And as I got better, I did what many people in my position do. I thought I was superhuman and started running, did my usual 5K, even 10K. And really, that's probably the worst thing I could possibly do. And it set me back. And in retrospect, it's taken about 3 to 4 months to really get over that pain. And what I did was got myself a most fabulous personal trainer who did the sensible thing of gradually increase my exercise tolerance, gradually strengthen my muscles, gradually give me the confidence to go back to what I think I am now, which is normal. So it does take time, but the piece that you showed, of course, they had multi-organ failure. This is very, very different from the stories that we're hearing about long COVID. Theirs wasn't long COVID. Theirs was recovery following, as I said, multi-organ failure, serious, catastrophic illness with months in intensive care.
Well, Paul, welcome to the programme this morning. Do you want to just pick up on your story as well? As I understand it, you tested positive back in March. And so from that point on, and how were you then and how are you now?
So I was extremely unwell initially. I managed myself at home. I had these 2 months of severe exhaustion and waves of illness. I saw a doctor after a couple of months. He said, look, I think it's now a post-viral situation that you're in. He reassured me that my heart and other lungs were okay. But then there followed another 4 months of complete exhaustion. Like Claire, I needed to avoid overdoing things because if I did, the illness would echo back. And then I sort of lapsed into a period of being frightened to go out and being frightened to do anything, really, and rather thinking this disease would last forever. And luckily, I met someone who had recovered from ME/CFS, and they helped me think positively about things, and gradually I've been recovering, pushing thoughts aside, and are now back to what I was before after 9 months.
Well, I'm pleased to hear that, Paul. I mean, the other thing, of course, you both have in common is that you're in a way experts. I mean, one a GP, one an epidemiologist. I just wonder, Paul, what, you know, you presumably knew a lot about COVID. You're an expert in this field, and then it happens to you.
Yes, you think you're an expert, but when it actually happens to you, you're an ordinary patient, just like everybody else, and you have to sit and reflect on what's happening to you. And it was an extremely frightening illness, but I've learned a lot about my own body and about how to recover, and like Claire, about the importance of gentle exercise and positive thinking to take you forward out of this. Late in the illness, I was obsessing about my symptoms the whole time, and the Facebook groups sometimes don't help very much because you just keep going back to how ill you are, and you need to try and use the symptoms are real, but you need to use techniques to move you forward positively into the new year.
Do you know what's interesting, Claire, listening to you and Paul, is that you're both very fit. You enjoy exercise, and it is psychologically, it's a real shock being told as someone, you know, who exercises regularly, don't do it because you're going to damage yourself. And then there's that fear, Paul touched upon this, that fear of getting back out there in case you get worse. What would you say, Claire? You know, there will be people, hundreds, thousands of people, you know, who are in this position and who are scared now. What would you say in terms of just living with the after effects of this?
Well, there is nothing that isn't made better through exercise, okay? Nothing, no matter what age, what condition, exercise will always improve it, but in moderation. And because I was fit, I mean, I have run marathons. I would regularly run 10K. I just thought, having had this illness, well, I've had it, let's go back to normal. So, and tried to run and did run, but it set me back. It set me back months because, of course, my muscles were not prepared for it. I don't know what the pathophysiology is, but I certainly had problems with my muscles. So what you have to do, for those listening to it, it's in moderation. It's gradual recovery, as Paul said. It's gradually, one step at a time, to use the cliche. It isn't going from nothing to how you were before, but just gradually increasing it. As I said, I've bought myself a personal trainer. He's absolutely lovely. He inspires me. I noticed that you have training on the BBC. Just gradually increase it and don't push yourself too much. This is not a marathon that you have to enter. This is just gentle exercise. And yes, Paul's inspiring. Just get those thoughts, try and change those thoughts around into what you can do rather than what you can't do.
It's good advice. It's good advice. Dr. Clare Gerada, thank you. And Professor Paul Garner, thank you both. And do take care.